With our recent summer-like temperatures, we have seen pollen counts skyrocket over the past several days. And while this time of year is always difficult for springtime allergies, climate change is impacting how long we deal with pesky allergens. So let's dive into what this really means for you and your health. Dr. Neelu Tummala is a board-certified physician with a focus in ear, nose, and throat health and co-director for the Climate Health Institute at George Washington University. Dr. Tummala, thank you so much for your time today.
Really excited to be here. Thank you for having me.
According to the Environmental Protection Agency, the lower 48 United States have experienced a large and steady increase in the length of growing season over the last 30 years as a result of our warming climate. So break down what this really means when it comes to allergies.
Yeah, that's a great question. So on average, global warming has contributed to an approximate 1.1 degrees Celsius rise in global temperatures. And so this has changed the basically general temperature and precipitation patterns for much of the United States. And so on average, data has shown that over the past 30 years, the environmental pollen allergy season has lengthened by about 20 days, so about 3 weeks longer, and there's about 21% more pollen in the air. So what this means for those people with environmental pollen symptoms is that their symptoms last longer. So this is the nasal congestion, the sneezing, the drainage, the poor sleep, all of these symptoms that people sort of have to suffer through when pollen levels are high, they're dealing with for a longer amount of time during the year. And with higher CO2 levels, plants and trees are growing more and producing more pollen. And so that also increases the severity of their symptoms because there's more pollen in the air.
And I think a lot of us are feeling it, especially this time of the year. And are you seeing any changes in what kind of allergens we have in our area?
So in general, again, with this change in temperature, we are seeing that plants and trees are able to grow in new areas. And so this is actually something I hear a lot from my patients where they say, I've lived here for forever. I've never had allergy symptoms. Why am I developing them now? And so one of the issues is that plants and trees can grow in new areas that they didn't previously be able to grow in. And so therefore, if you didn't previously have issues with some springtime allergies, which tend to be more of like the plants, or summer allergies, which tend to be more of the grasses, you may now be developing allergies because the temperature and precipitation patterns are changing. And this is something we see a lot with climate change when we see like different vector-borne diseases being able to thrive in environments that they previously weren't able to. Again, as the atmosphere is changing, as temperature and precipitation patterns are changing, the suitability for certain plants and trees or vector-borne diseases is altering.
It really is fascinating and honestly quite frightening how climate change is impacting our health in so many ways that we might not even realize. So what are some of the signs and symptoms that people should look for and be aware of, and who is most vulnerable to these changes?
Yeah, that's a great question. I was actually just giving a lecture to some of our medical students about this because it's really important for healthcare professionals everywhere to be aware of the health impacts of climate change. But as you said, there are a lot of vulnerable populations that also need to be cognizant of it. So those most vulnerable are going to be the ones that are least able to protect themselves. And so that is our elderly population and children. And so as the season's getting warmer, and we know with climate change, with this global warming, heat extremes are more common. We really need to be cognizant of those who are going to be most at risk, which again is the elderly and children. So for the elderly, it's really just making sure that they are staying in cooler environments, that they're staying hydrated, and that they have less adaptation abilities to be able to adjust to the extreme heat, which one of the risks of climate change and global warming for the elderly is increased risk of cardiovascular disease. And a part of that, again, is just increased thermal stress on the body can increase their risk of developing heart disease and potentially even a heart attack. For children, one of the main concerns is that they may not be able to communicate when they're overheating, and they may not be as mindful as some of the symptoms of experiencing heat extremes. And so really being mindful with children and making sure, again, that they're staying hydrated, that they're not outdoors during the extreme heat, and that they're playing in the shade, and really, again, just watching out for any sort of symptoms of heat stress or heat stroke. In general, though, sort of going back to your question of what are sort of these broader concerns of the health impacts of climate change, it's not just related to heat. Again, that's something to really be concerned about. But we know that the range goes from like the mental health concerns of climate change, so increased risk of anxiety, depression, violence during heat extremes, to the spread, as I mentioned before, of certain types of infectious diseases. So West Nile virus specifically is really spreading northwards, again, as temperature and precipitation patterns are changing, cardiovascular disease, pollen allergies. So a lot of different sort of areas to think about in terms of how climate change is impacting our bodies and our health.
We really just hit the tip of the iceberg here with this conversation. There is so much more to talk about, but for now, I do thank you so much for your time and for your knowledge.
Thank you for having me.